What in the hell are we doing? While I'm urinating in the middle of London because of a bottom surgery that's completely and totally experimental, I get, infections every 6 weeks. I probably won't live past 10 years.
The rapid expansion of gender-affirming care, which includes child medical transition like hormonal treatments and surgeries, has progressed without the rigorous evidence base typically required for medical practice. Initially, it was only very young children and middle-aged males who presented at clinics with gender dysphoria. The young children typically grew up to be gay, lesbian, or bisexual, while the middle-aged males were often experiencing autogynephilia. In the last decade, however, there has been a staggering 4,000% increase in adolescent female referrals and a 2,000% increase in male referrals. Despite this surge, a compelling evidence base to support these interventions remains notably absent.
Tell me a journal that has done systematic reviews that cites different evidence, that cites strong evidence for benefits of these therapies.
The standards of care were developed based on extensive...
You're not telling me any journal, you're not telling me any study. Don't say standards of care.
Yeah. So...
Tell me one.
The standards of care.
The standards of care refer to the guidelines and criteria that define the appropriate level of care and services that healthcare professionals should provide to patients. In this context, WPATH, or the World Professional Association for Transgender Health, uses this term loosely and has been heavily criticized, especially since WPATH added terms like eunuch and removed their chapter on ethics, as well as the minimum age requirements on hormone treatments and, more controversially, on procedures such as mastectomies and genital surgeries.
We really want things to be safe. We really want kids to have really good assessments.
In terms of masculinizing top surgery, I think 12 is the youngest who's had surgery through our program.
The primary protocol that WPATH drew their standards of care from was developed by the Dutch. The Dutch protocol, crafted by Dr. Peggy Cohen-Ketnis for 12 to 14-year-olds with persistent childhood onset gender dysphoria, serves as the foundational model for treatment that has significantly shaped contemporary practices. Although this protocol seemed to reduce gender dysphoria, it reported no statistically significant improvement in associated symptoms such as anxiety and depression, and its methods were quite flawed. Studies published in 2011 and 2014 of the Dutch protocol found that of the original 70 patients in the study, only 55 continued to participate. It was marred by severe underreporting of adverse effects, including a patient's death from surgical complications.
Gender-affirming care is life-saving.
We need access to the medical care that saves our lives.
Additionally, the questionnaires used to assess the patient's outcomes were poorly worded and led to unclear results. No gender clinic anywhere in the world has been able to replicate the results of the Dutch protocol. Despite these shortcomings, the protocol has been promoted as the international gold standard for treating gender dysphoria and has been widely adopted. As the protocol's influence grew, its originally stringent criteria were relaxed, allowing not only adolescents without a consistent history of gender dysphoria, but also those with significant mental health challenges to undergo radical treatments such as puberty blockers and even surgeries. The removal of the therapy requirement and the labeling of any hesitation to provide puberty blockers or hormones as transphobic by groups like WPATH further facilitated a less cautious approach.
The problem is, of course, what they don't like to talk about online is all the really dangerous stuff that comes with testosterone too. Like it leads to infertility, like a risk of heart attack goes way up.
Triggered by mounting concerns about the practices of the UK's Gender Identity Development Service, the 2024 Cass Review, led by Dr. Hilary Cass, emerged as the most comprehensive review of youth gender medicine to date. It uncovered significant issues such as inadequate patient assessments, premature medicalization, and failures in safeguarding. Highlighting the field's reliance on remarkably weak evidence, the review emphasized the absence of reliable data on the long-term outcome of these interventions.
You need to understand that it's not always so positive. I don't even know the other effects that 30 years of testosterone on my body has done to my body. I know it has changed my brain. I know that there are things going on with me that I'm sure are affected by the testosterone. But again, we don't have the research.
The University of York conducted multiple independent systematic reviews commissioned by the Cass Review, which evaluated scientific papers related to youth gender medicine. These reviews found that only 2 out of 103 studies were of high quality, with a significant portion, 40%, so poorly executed that they had to be excluded from analysis. All of the current quality research reveals no evidence that puberty blockers improve body image or alleviate dysphoria. And the minimal evidence for mental health benefits could likely be attributed to placebo effects or additional psychological support. Significant risks were uncovered, including low bone density, reduced neurocognitive ability, and disrupted sexual development. Similarly, the data on the usage of cross-sex hormones highlighted a glaring absence of long-term follow-up studies, rendering it impossible to draw reliable conclusions about their effects on various aspects of patients' health and well-being. Furthermore, the CAS review criticized the current gender-affirming care guidelines established by influential organizations like WPATH and the Endocrine Society. These guidelines, often based on consensus rather than empirical evidence, lack transparency and rigorous scrutiny, which leads to a cycle of recommendations that frequently reference each other without integrating new independent research.
We're bringing in trans medicine, if you like, in line with the rest of healthcare, because it's not fair that this group of children, who are very vulnerable and very distressed, receive a poorer standard of care than anybody else should expect.
Addressing the often cited claim that gender-affirming care is crucial for preventing suicide among trans-identifying youth, several longitudinal studies have provided clear evidence to the contrary. For example, a 20-year study commissioned by the Swedish government found a suicide rate of 0.6% among gender dysphoric individuals, while GIDS at the Tavistock reported a 0.03% suicide rate among trans-identifying youth over a decade. And a recent Finnish study concluded that gender-affirming care did not significantly reduce all-cause or suicide mortality rates among adolescents and young adults when compared to matched controls. Compounding these findings, a comprehensive 30-year study involving 324 individuals in Sweden found that those who had undergone sex reassignment surgery faced a suicide risk over 19 times higher than the general population.
All gender-affirming care is age-appropriate, medically necessary, supported by all major medical associations, and in many cases, life-saving.
The issue of detransition rates adds another layer of complexity. Research by Dr. Lisa Littman indicates that 76% of those who detransition don't report their detransition to their healthcare providers. Short follow-up times and high dropout rates from studies introduce significant biases. Many individuals who detransition may stop attending follow-up appointments, meaning their experiences go unrecorded. In 2019, there were less than 1,000 members on Detrans Reddit. Today, there are over 54,000. Moderators on this site say 2/3, which is roughly 36,000, are detransitioners. The others are interested observers.
When my specialist first told my parents that they could have a dead daughter or a live transgender son, I wasn't suicidal. However, at 16, after my surgery, I did become suicidal. My doctors had almost created the very nightmare they said they were trying to avoid.
The underreporting of detransition and the loss of follow-up issue create a substantial gap in our understanding of the long-term outcomes of gender-affirming treatments. In conclusion, the practice of gender-affirming care is critically unsupported by a quality evidence base. The significant methodological weaknesses and the lack of robust empirical evidence make these radical interventions inappropriate. The push for these medical treatments, in the absence of solid proof of long-term safety and efficacy, places vulnerable populations at risk. This underscores the necessity for a reevaluation of the widespread implementation of these interventions, highlighting the importance of evidence-based treatment that prioritizes patient safety over unvalidated treatment protocols. For more information, go to genspect.org. Thanks for watching.